dentist for their offices, and have known Dr. Zeta and Dr. Klein now for going on over a year. Helped them find great opportunities in the state of Florida, and I know I've spoken with quite a few of you on the call this evening. Certainly look forward to keeping in touch with you moving forward. To Maggie's point, seeing you all in person at future events in the beginning of next year, and just really excited and happy to be on this call. And I think it'll be very valuable and informative for all you students who are attending to kind of hear directly from some of your peers on what their experience has been like at Aspen Dental, and answer any and all questions that you might have. So,
Thanks, Ben.
yeah.
We'll go in alphabetical order. Dr. Eric Klein, can you give a little bio first and let us know
Uh,
where you're practicing?
yeah, so I know a lot of you guys in the chat, but I'm practicing in Bradenton, Florida. It's, just about 35-ish minutes south of Tampa, in St. Petersburg. And I'm practicing with Dr. Tran, who is like slowly become my idol. Like the man is incredible at what he does. And, it's just been a super great experience to be with him. And not only him, but I know Juan might be able to touch on it too, but he and I have a doctor meeting through the Dixon PC, who is the doctor that we, kind of all work for. And, we have our monthly meetings, and we have an implant Bible that we're going to be crushing tomorrow. So it's a great experience.
Nice. Thanks, Eric. Dr. Juan.
Okay, guys. So, some of you, I remember some of the names, not all of them, so forgive me for that. But yeah, I'm Dr. Zeta. I work in Lehigh Acres, so the Aspen Dental in Lehigh Acres. I live in Fort Myers, so it's like a nice 20-minute drive for me. And so far it's been good. It's been a lot of work, but I think it's been a really good opportunity for somebody coming out of school to instantly be seeing a lot of patients, be on the move, and be instantly exposed to a bunch of different procedures. So that's what I wanted, and so far so good. So
Awesome.
we will go more into detail on that later, I guess.
Yeah, I want to take it back a little bit to your D4 year and just the recruiting process. We have a great experience in Chicago called We Got You, where D4 students and residents come out. We bring you out to Chicago for a Friday and Saturday. You get to tour our headquarter office, our oral care center, where we do our live patient implant training. And I wanted both of you to speak to that because you experienced it, and what that did for you, and how that molded your decision to join Aspen Dental. Because for the students that are listening right now, we have sessions coming up in December, January, February, and March. One session each month for students that are interested in Aspen Dental and are talking with Ben and myself. We can get you on the invite list to come out to Chicago. So Eric, can you touch upon your experience that We Got You in Chicago?
Yeah, I was communicating with you and Ben, all of D4 year, because I knew I was going to sign with somebody. Who was going to be the company I signed with. And, after getting to know you guys, that was great right there. And I know it sounds corny, but it's a very family vibe. Like, I know I can reach out to these two for anything, not just work related. And they got my back. But when we went to the actual Aspen headquarters in Chicago, it was like that right there. Maggie, do you have a testimonial of anybody from that experience? Perhaps you share that.
Maybe a video that I could share after this call. Yeah, I do.
Yeah. But as soon as I went there and saw the headquarters, you're blown away. It's in the middle of Chicago. It's probably the most beautiful building out there. And then they have an entire clinic that's, probably the same size as Nova's clinic at school, but it has all the state-of-the-art technology. I'm actually signed up to go January 23rd to the OCC to do my implant course training to be certified placing implants.
And you just came back from your new doctor training, correct?
Yeah, yeah. So I did my 6 month doctor training literally last week, and for everybody out there listening, dentistry is tough. What you do in Nova, it kind of scratches the surface, but I'm sure Juan can also testify to this. As soon as you get in the real world, I mean, you go 0 to 100 real quick. At the 1 month journey, I mean, the amount of education you get from Aspen is like that right there is worth it. And at our 1 month, they taught us a completely new way how to do dentures. And I think I've got dentures down in like a 2 visit process. And that was at the 1 month. At the 6 month, I didn't know anything about business, and they taught me all about metrics, how to actually be profitable, how to run a schedule, because the real world isn't like Nova where you have 2 patients a day. It's like I'm jumping between 3 or 4 patients at a time and every 30-minute block. So it really opens your eyes as to this is how you do it in the real world. And the headquarters has been incredible at giving us this opportunity to learn these things.
Awesome. Thank you, Dr. Klein. Dr. Zeta, your
Yeah.
experience
So
at We Got You.
yeah. So the when I went to We Got You, I mean, I had already signed right with Aspen. So usually you go when you're like undecided and stuff, but it really felt like, oh, like, I made the right decision going there, right? It was really really cool seeing everything they got there in the OCC, right? And the state of the art technology, like everything we use is state of the art, like from the scanners to no more prime scan, no more fighting for those at Nova. Like it's everything is like brand new. And I think that was like a really cool experience. Also to meet other doctors from different places, right? Um, they kind of like link you up with it's all random, so that you could I met people from Indiana, people from New Hampshire, all over. So I think that was a really good experience. But I mean, to speak a little bit on what it's like to go from Nova to working, is it's very different. Like it hits you in the beginning because, like Eric said, like you're not seeing 2 patients a day, right? Like it's a lot more. And it's, at least from my experience, right? I was thrown in this clinic that is very 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 busy. So I was able to, week one, I was already doing everything, right? Really doing everything. And it's really cool to see, like, we at school we learn things kind of the hard way. We have to do every step of the process. But I feel like in the real world, like you learn how to simplify uh, these lengthy procedures that you know, would take us like 5 appointments to do a denture. Like here, you do it in like two, right? So um, it teaches you how to move quickly, and how to be able to do a lot of different things. So so far, it's been a good experience.
Right. Thank you. Ben, I was hoping you could touch on, with Eric and Juan, they went through, attended a few events, had conversations with you, shadowed offices. Can you just talk to, what your role is and how you can connect these students to not only getting to We Got You, but getting to the right opportunity that they want to be at?
Yeah, absolutely, Maggie. So, kind of the first step, which I've done with a lot of you students that are attending tonight, and thanks again for attending this event, is having a 30 to 45 minute just phone call to kind of get to know you, answer questions that you have on the front end about Aspen Dental, but also kind of understand what's most important to you in finding that right opportunity. And then from there, I kind of view myself as a matchmaker. I'm presenting to you all the best opportunities that I think you'd be the most interested in based off our initial conversation. Um, and then depending on where the office is located, sometimes we'll do like an initial virtual interview for you to speak with the owner and the team of that practice, and then move forward with actually doing an in-person site visit. And what I've told students before, and Dr. Zeta can attest to this, is, if we find one specific opportunity and for whatever reason, it doesn't check off all the boxes that you're looking for in that right first job opportunity coming out of school, that is by no means the end of our conversations, right? You know, I can pivot, present to you other opportunities that hopefully do check those boxes, and hopefully find you the right long-term home.
Beautiful. Everybody that's listening, if you guys have questions, just post them in the chat and I'll get them delivered. I know I had a phone conversation with Dr. Klein just about 30 minutes ago, and he was driving home from his clinic. He had an end of the day surgery. I know you wanted to tell your day story to all of us, so fill us in.
Yeah, I mean, anything can happen in the real world. And, it's like, I feel like a lot of the stuff that you learn at school, you're like, I don't know if that'll ever happen, or if it does, I'll be ready for it. I mean, today I was, routine extractions, 14, 15, excuse me, 15, 14, and 13 on this gentleman. And the big guy, he was like 6'7", 6'8", and he had teeth like Godzilla. And when I pulled his teeth, his entire maxilla came with it because he's, an older man. Everything's ankylosed. And I had a sinus exposure that was like, I don't know, man. When I tried to measure it with a perio probe, it was bigger than the entire perio probe in a full 360. So the great thing about being in our offices is we're not just thrown to the wolves. It's like, you know, it was freaky, but I like just stopped for a second. I'm like, okay, things can happen. And I go to my mentor doctor, the MCD, and I was just like, hey, Dr. Tran, I need to see you in this other room real quick, very nonchalant. And he's like, yeah, I'm glad you got me. And then he and we spent their whole, rest of the time. We kind of went over hours because it was a very, very big sinus communication. And thank God I had him there, because if I were on my own, this routine extraction would have become some nightmare case. But then it became the biggest learning experience. I learned how to do a lateral sinus window flap. Um, Not only did he teach me a new technique to bone graft a sinus, because I mean, you can't just shove bone graft in a hole. You have to create a membrane and do all this stuff. So it was such a great learning experience that I was afraid to perf the sinus, and now I'm super glad that I did perf the sinus, because now if I was on my own, I would know exactly how to handle it.
Right. Amazing. Yeah, and you're like amped up. I don't know how you're going to go to sleep tonight. Dr. Zeta, do you have like a crazy case recently that is
I
top of
mean,
mind for you?
so yeah, I mean, I've had a couple different. I feel like a couple different situations that you're like, oh shit, right? But like the beauty of it is, I'm really the reason why I'm like so glad that I picked Aspen in the office where I'm at is, I have a really good mentor doctor, and like Eric was saying, like anything goes south, like you feel like you have somebody there, and you're not just like on your own. Because looking back, like some of the situations that I have encountered, like I wouldn't exactly have known what to do, and having somebody there that has already gone through that and it's like, okay, you know what, this happened to me and this is how to fix it, right? Like huge help. So that part of it is huge. I mean, I remember in school, like you learn about like putting the patient back in like Trendelenburg position or whatever when they faint. I've had two patients that fainted. One of them fainted. It was like the first week. Um, it
Wow.
was like simple extractions. This was my first week at work, right?
Yeah.
And all I'm doing is I'm just doing like a block, and as soon as I'm done doing the block, the patient is like just falls back in the chair, and I'm like, oh damn, like what the heck do I do? But it was like Eric was saying, like I'm glad it happened because the next time that situation happened, I was ready for it. And I knew what to do, and that day I just called over the other doctor and was able to figure it out. So thankfully, it was nothing like these patients. Like it was, they've had that happen to them before, but they just thought it would be a good idea just to not tell us. And I was like, why would you not tell us that, right? But like just like handling emergencies is like huge,
Mm-hmm.
like a big part of dentistry, right? Because like it's pretty easy to do an extraction when everything goes right, right? But like when things go south, like that's when you want to have somebody there. So Um, I do, I mean, at least in my clinic, tons of extractions, right? Uh, I mean, that's like pretty much what I do all day, extraction, and it's, a lot of surgery. That's what I like. So, um, I'm also able to coordinate with the other doc and tell her like she knows I like to do this, so she'll do other things that maybe she prefers to do, and just leave me all the surgery. So,
Nice.
that side of it is also pretty cool.
Yeah, very cool. So most of our offices are owned by our doctors. And in the case of Dr. Klein and Dr. Zadia, they work for a practice owner. Their mentor doctor is the lead doctor in that office. So, and you guys get together as all the offices do. You have a meeting tomorrow night, I believe, right? And that happens how often? Are you guys together? Monthly or every other month?
Yeah, it's every second Wednesday of the month. The only reason
Okay.
it was pushed back a little bit this time is because myself and one of the other doctors were in Chicago for training.
Yeah, so there's this, amazing sense of community. I always say Aspen's like the biggest family I've ever been a part of. Um, I've been with Aspen for almost 5 years now. I've been a patient for 15. I never knew my Aspen doctor was my practice owner. Never knew that till I joined Aspen. It was pretty cool. I've always been a really happy Aspen patient. The marketing that we put into our offices, we're all branded Aspen Dental for a reason. It's national marketing that drives new patients in our doors. It's crucial to our business. So if you guys could just talk about how many new patients on average you're seeing each day and what that's like.
Yeah, I mean, we see a ton. And actually, so, we open one Saturday a month. And this Saturday, I'm not treating patients at all. We call it a new patient run day. So I just have from 8 to 1 p.m., nothing but new patients. And I think I'm seeing, 14 people that day. And for those of you that want practice doing treatment planning, I mean, trust me, you'll get your practice. And the nice thing is, like Maggie was saying, being national, we're in a big snowbird community. I can't tell you how many people start treatment in, New England, like Maine, any of these, adjacent states. And I see them now. And it's super nice because I've made connections with people in other offices in other states where I'll get this patient and I'll message them on our Teams chat and I'll be like, hey, I have such and such here. I saw you planned this. Do you mind if I deviate to do this type of procedure? And they're like, oh yeah, go for it. So it's nice that, we can bounce ideas off each other. And, like Juan says, we get together, with our doctor meetings once a month. So we see all of our friends and we study for a bit and then we all hang out afterwards.
Nice. Nice. Juan, how's your patient flow in your office?
Yeah, so the patient flow at my office is absolutely insane. There's so many new patients. I feel like that's also, the location. That was one of the things that, I did talk about with Ben beforehand. I remember like that being super important. I was like, I want to be in a location that has a ton of patient flow. This office opened up in 2023, and I swear it's got to be like on the whole West Coast, it's got to be one of the top ones for new patients because I feel like I see so many new patients. And like Eric was saying, like Saturdays, they put like a lot of new. I also do procedures, by the way. I know you just do new patients. They also shove some procedures in there, so I'm doing procedures as well. And like that side of it, like at least for me, the hardest thing was treatment planning, right? Like when I came out
Hmm.
of school, I would like you get like the basics of treatment planning, but then when you have a patient that hasn't, been to the dentist in like 10 plus years, 15 plus years, like it all just kind of goes out the window and it's like, damn, like what do I do here? Right. And having that, mentorship from the lead doc, I think that was huge. It's made my treatment planning go up like a million times. I never really understood it, why they said like, treatment planning is so hard until I started working and I'm like, okay, like I get it, because there's in dentistry, like you could have me and then you could have Eric like see a patient and we would have two completely different treatment plans. And that's like a common thing. So you just got to do what's best for the patient and you learn that slowly. And having somebody there that, has your back and is willing to help you out, it's huge. So
Yeah. Nice. And so your office is open one Saturday a month as well,
yeah,
right?
yeah, one
Yeah.
Saturday a month, 1 to 3, and it's yeah, mainly like new patients. It's really easy to schedule new patients on Saturday. Like most people can make that appointment, so there's not really a lot of issues with work and stuff. So it's
Mm-hmm.
yeah, we alternate. So I'll do one Saturday, and the other doctor will do another Saturday. So
Oh, nice. Yeah. So
yeah.
not all of our offices are open a Saturday a month. Your days are typically Monday through Thursday, 8 to 5.
So I work uh I work Monday. I feel like every office is a little bit different, but like I
Yeah.
work Monday, Tuesday, 8 to 6. Wednesday is like a longer day, so we try to make it very accessible for the patient to be able to come in, and not everybody can come in like 8 to 6. So some patients
Mm-hmm.
can only make that late appointment. So Wednesdays I start later. So I work at 10, start at 10, and then I work till 8, right? So that's a late day. And then Thursday I'm back to 8 to 6, and Friday I work 8 to 1.
Mm-hmm.
So Friday just like flies by, and then the one Saturday a month is not too bad. So
Yeah. So you have some long weekends in there.
yeah,
Is it about the same for you, Eric? Your schedule?
Yeah, I was gonna say we have, our 8 to 5, 4 days a week, and then we do the 1 or 3 days a week, and then we do one late day where we start late, but we stay a little later to accommodate for those people that can only come, after work or whatever. And then Fridays are always a half day, which is
Yeah.
the best. Fridays are the best.
Nice. Nice. So talk about like how your lives have just changed. I mean, it hasn't been that long, right? It's like, has it gone by fast? What is different about your life right now? You're making money. Are you traveling? Did you buy a really nice sofa
Yeah,
at Costco?
I didn't buy the sofa at Costco. I bought everything else there though.
Okay.
No, but yeah, I feel like it's been a blink of an eye since graduation to here. It's kind of nuts. But I mean, also with that being said, I feel like myself as a dentist now, like it's weird that I'm no longer a dental student. I'm actually a dentist. And now, people when they come to see you, they don't see you as a dental student at Nova. They see you as a doctor. And if you don't do something correctly, they will try to sue you. You know what I mean? So you have to, yeah, I don't know. My professionalism has increased. For those of you that knew me at Nova, I know that's hard to believe, but I feel like I'm actually a professional now. At least I pretend to be. But no, it's been such a crazy experience, and yeah, finally, no longer having to live loan to loan. Actually, getting a paycheck is pretty nice.
Yeah. What about you, Juan?
yeah. I mean, it's nice to make money. I'll say that. That's fun. So that's been good. I feel like, yeah, it's a lot of work. So be ready for that. Like I'm not gonna sugarcoat it. It's work, right? Like you're gonna be there. It's long hours, but I feel like that's what you want, or at least that's what I wanted. I wanted to come out of school and be like, you know what? I want to learn dentistry. I want to actually like get the hang of it, because there's so much to learn. Like when you leave school, you're like, wow, like it's just kind of crazy. Like it's just shocking, right? You get to the real world and you're like, all this new stuff, everything's different, right? Everything's handled differently. The way you do procedures is differently. You learn a lot of shortcuts. I will say, like good shortcuts, not like you're skipping over important steps, but like ways to do things correctly that save time for you and the patient. And I feel like we can all agree that like that was like one of the biggest things at Nova is, patients would really get frustrated because they would be there for forever, right? And you know, it's really cool to be able to see yourself grow as a dentist. And it's only hasn't even been 6 months, honestly.
I know.
I feel like it's been, it's flown by, and it's been super cool. So
Yeah, nice. We don't have any questions coming in yet. If you all have questions, you can post them in the chat. Let's just touch upon, besides your mentor doctor, you have support within the network. And if you guys can speak to that at all. Each office is supported by a regional manager and a territory director. They're your boots on the ground that, if your owner has a problem, your lead doc, you guys probably know your regional manager the most, who probably stops in every other, once a month, maybe, depending on their coverage. But then you have the whole clinical team, right? The people you've come in contact with in Chicago. Um, have you used that support at all in this first part of your career?
Yeah, I used it a couple days ago. So we're clear aligner certified now, which everybody thinks Invisalign, but Aspen has its own brand called Motto. So it's clear aligners, but they're not overly complicated, but there are certain things if you don't really understand ortho, like I don't know, coming out of dental school, I wasn't an ortho genius or anything, but I actually used Dr. Atai, who's like the man when it comes to clear aligners. This guy's been doing it forever, and I submit him a case, and he practices out of Orange County in California, and he walked me through how to do everything, from his phone while I was kind of, hey, how do I submit my first case kind of deal. So he
Yeah,
walked me through it.
everyone's accessible. Juan, have you been working at all with the clinical team?
So I know we have all these resources. I personally have not yet, but I know they're all there. I mean,
Mm-hmm.
I really use my lead doc, and any question I have, I just kind of ask her, and she's been great at like answering any question. But usually, when you have like a more complex case or something like that, I mean, you have people that are really good at what they do.
Mm-hmm.
And uh, and they're there for you. And I wanted to touch up on kind of what you were saying about your regional. So I don't know if you guys are aware, but it feels good that in Aspen, at least I feel like we're not understaffed. I feel like we have plenty of people to run an office properly, right? At my office, we have six DAs, right? So I mean, it's a yeah, it's a busy
That's
office. We
it
actually
is.
we need them, and sometimes they do overtime. So uh, and if you also have a regional. So let me back up. So it's you. So you're the associate. You have your lead doctor, right? So it's two doctors are running most. I would say most offices, right? Every office has an office manager. So the office manager, they do so much work, right? So they do consults, any issue with the patient, talking to insurance, all of that, they're the ones that are in charge of that. That's good because that's something you don't really have to worry about. You don't have to worry about like what you know things cost, which every patient is always going to ask you that, how much is this going to cost. And it's cool to say like, oh, you know what, we have a team up front that handle all of this, right? So I don't even have to worry about that, and that's super cool because that lets me focus on uh, everything else that I have going on. So, and then on top of that, you have your regional manager. So the regional manager is kind of like an office manager, but for a bunch of offices. So they are like overseeing all these different offices, and they come to your office once a month. And what's really cool about that is that they do MORs, which is, I don't even know what it stands for, monthly operating report or something like that. And
Don't
what
ask me what it stands for either.
I think you're
okay,
right, Juan. I think
you
you're
do
right.
monthly something report. And you kind of like go through a bunch of numbers, and it's cool to see like how a business runs, and everything that goes into it, like the money coming in, where the money goes out, and how it disperses throughout. Like that's kind of cool. And then you also see how you guys can improve as an office, as a team. Like, hey, this month we could have ordered less of this, or we spend money here when we shouldn't have, and all of that. It's cool to learn as well, right? Because that's the real world, and that's how a business runs. So
Yeah.
Yeah. Can I touch on that too? Like what
Yeah,
Juan was
for
saying
sure.
about, our RMs are great at, you know, don't get me wrong. I mean, work is work. It's not dental school anymore where you get Christmas breaks, all like fall breaks, whatever breaks, so you're on a real schedule now. And for a lot of people, that's new to them, especially because they did undergrad, dental school, and then now it's their first kind of real job. But the great thing about having our network is like my neighboring office, one of the doctors wanted to go on his honeymoon. So he was gone for 2 weeks. And so then I was positioned in his office for 2 weeks covering it. And it was great because it gives me the experience of running an office on my own to, both grow in my own and show that, you can do what it takes to run an office by yourself. But it's also nice that if you want time off, as long as you take the proper channels, they'll move people around so that you can cover for a week or two, and then you're back in your own office, just so everybody doesn't get that burnout, and you don't feel like if I miss work I'm going to get in trouble. It's like, no, we'll find a way to make it happen.
Yeah. Yeah. So my big message to students all the time is it's not where you're working. It's not even the DSO necessarily that you're working for. I mean, I believe, are set apart, but it's really who you're working with and for, meaning your owner or your lead doc. If you're not connecting and working well with that person, it's going to be a terrible start to your career. And I don't know how you guys feel about just simplifying it down to that. Like, it's about who you're working with and for that's going to enhance the beginning of your career.
Yeah, definitely. Like, the doctor I work for is the biggest dental nerd on the planet, which is like the best person to have. He and I will sit, he not like he grades my work, but he'll go through, a crown scan, and he'll be like, hey, look what you did here. He's like, next time, keep this in mind, change this up, use this type of burr. He's like, I'll make it so much easier, and then you'll get a better margin or whatever. And then you do it once and you're like, damn, okay, his advice was legit. But like, the main thing, I want everybody to go out, do their research, talk to any of their friends that graduated last year that aren't with Aspen, and ask them what it's like to be in an office that pays you solely on production, because that is the big key that sets Aspen apart. Juan and I can testify on this firsthand. He and I have been sinking implants into patients already because we have these great mentor doctors that look over our shoulder. Not one case comes through the door that my owner doc tries to hoard from me. He and I share everything, because when you're in a non-sharing profit margin office, if you think you're going to get cases beyond fillings and crown preps, like, that's just not going to happen. Whereas our doctors are like, man, we have all these cool implant overdenture cases, single crown implant. He's like, you should do this. And then, like, I'll just show you how. While you're doing it, I'll do your fillings or whatever is on your schedule. And then that way you can get experience placing implants. And because they're not trying to make the production, they share everything with us, and it's just that alone helps us grow so much faster than everybody else in the different DSOs, honestly.
Yeah, I just want to explain it a little bit. So our compensation model is a guaranteed daily rate that never goes away. So you're paid every 2 weeks a salary. It's a guaranteed daily rate. We don't ever take away from it. And then as an associate doctor, you are part of the profit sharing model, which is 8 to 10% each month. So you get a bonus each month if the production of the entire office is doing well. So we take your compensation that you've already earned through your guaranteed daily rate, and if the production at your percentage exceeds that, you get a kicker each month. I'm not sure how you guys. It sounds like you're in busy offices and you're getting profit sharing, I would guess. Um, so that's what Eric's talking about. It's shared. So nobody's fighting over procedures. Juan's not fighting with his lead doctor about a procedure because they know who has the strengths in what areas. And they're like, hey man, take that. No, you grab it. There's just a lot of give and take and camaraderie. How do you feel about the compensation model, Juan?
Yeah, I feel like kind of like what you guys were saying. You know, that's something that I really looked into a lot before signing for Aspen, and I'm not gonna lie, that was probably one of the biggest things about me making my decision to sign for Aspen. Um, I didn't, I didn't want to go necessarily, even if I, could have made more money. I didn't necessarily want to go to another, uh, uh, outside office and have a doctor there that I knew for a fact they were going to take all the nice procedures and then leave me with, all the not nice procedures. So I guess the good thing about Aspen really there is, you do everything. Like you really do everything, and the other doctor has no reason to hoard procedures or hoard implant cases or hoard these really like I did the other day. It was like 4 anterior crowns, and like I wasn't lucky enough to do that at Nova. So like you do stuff like that. You do really complex stuff, and they have no reason to hoard it for themselves. So you end up doing a lot more than you would at a different office. So um, I feel like that's been really cool, and kind of like what Maggie was saying with the profit sharing. So you have your daily rate, and you're never going to earn less than that, right? If your office does well, you can earn profit, and the profit comes from really everybody working in the office. We have an oral surgeon that comes through twice a month. Um, Endodontist, he comes through 2 to 3 times a month, and at the end of the month, the hygienist as well. The hygienists produce a lot in Aspen, and kind of like a collective of all of that is how you figure out your profit. So
Yeah,
Yeah.
excellent. So, I mean, our model is to grow you as a doctor. We're not holding anyone back. Um, you know, the steps are to typically out of dental school is to begin as an associate dentist and then move on to an MCD, which is a managing clinical director, the lead doctor. Um, Always opportunities to own as well. I'm sure I just have an inkling. Are you guys looking at a future of ownership, possibly? Either one of you? I see smirks.
Yeah, I was already
could be.
like, the thing is, it's like I've been with the company 6 months, and at the 6 month journey, it's like, you don't think these people are keeping an eye on you, but they are. Someone's always watching, and yeah, I mean, people have been talking to me about opportunities that I can pursue, and I mean, I'm all in on it. It's been a great experience so far, so I'd like to take that next step.
Yeah, so we open a new office every week. We're at like 1,055 offices right now in 46 states. Juan, how about you? Do you see ownership in your future?
Yeah, definitely. I mean, it's kind of cool because it's like sequential. You start out as an associate, which is great because you have somebody there that is teaching you everything. At least for me, even if an MCD position was offered in the beginning, I probably wouldn't have taken that because I don't know how to run an office coming out of Nova, right? Um, so it's cool to grow into that, and then you become MCD, you run your own office, and then after that you'll have that option, right, to become partner in an office. And I mean, there, I mean, you can make really as much money as you want if that's what you want. So
Yeah, very cool. Well, we don't have any questions coming in. Do you guys, isn't that crazy? You're doing such a great job. I mean, if you were a
Why
dental
is
student right
everybody
now,
afraid to ask questions? What's
they're
going
so quiet. They're so
Yeah,
quiet.
if y'all don't know how to do the chat feature, by all means, feel free to take yourself off mute and ask
Yeah,
away.
ask away. If you guys were in dental
on?
school
We'll
right
wait.
now, what would you be asking? What would you be
we
asking?
got to pick on them. We got to pick names.
Yeah.
I'm kidding. I'm not.
If you guys were in
I
dental
mean,
school right now, what would
I
you be
remember
asking,
when
Eric?
I was, yeah, when I was a D4, I knew I wanted to go somewhere to work. So, I mean, I know I was growing Ben nonstop. Like, I don't know how much you and I must have talked that first couple months or whatever it was. But, I was always asking him, like, you know, what locations are best? Where should I go to be the most successful? Because I think the main thing people don't understand is it's like, sometimes downtown Miami, Brickell isn't always the most successful market. You know, you got to go somewhere that you can grow as a doctor, and then perhaps you can make your way back to these other places. But it's like I really partnered with him. I'm like, in your experience, where should I be? Who should I be working with? Because I mean, that's everything. You don't want to just be in a slow office where you're sitting around. You don't want to be with a doctor that doesn't care to train you. So for me, it was all about getting teamed up and being in a place where I was going to get my reps.
Yeah, excellent.
So I feel like for me, something I was really, and Ben knows about this. We went back and forth for a long time because we had a couple different offices, and I'm really big on numbers, right? And not like pay numbers, but just like there's a metric for everything really in Aspen Dental. So I was when I sat with him and I talked to him, I really like compared the different options, right? So he was like, Juan, these are the offices that are, that are open in the area where you want. I wanted to stay in Florida, and he kind of like showed me what was available, and I was able to compare like something really big for me, and it should be for you as well. Is new patients, right? That really talks about how healthy the flow is in an office and how much that office can handle. If you see an office that is seeing like 1 to 2 new patients a day, like you're probably not going to be doing a whole lot there, right? If you see an office that's seeing like 10 to 12, or I don't know, 10 to 12 is a lot, but I don't know, maybe like 6 to 12 new patients a day. That's also a lot, right? And you're going to be, because that's how you get procedures. Like the procedures don't just show up there; they come from new patients. So that's a really important metric to look at. And also, really just kind of, can that office fit you, right? Like, are you, if it's another doctor and yourself, like, are there enough procedures for both of you? And I think that's something that you need to think about, and something that want to ask. Like, don't just. I mean, I wouldn't just go into an office that it's in the location I want, but like not looking at the numbers. You really need to like dive deep and really break it down and look at everything. I think that's going to be really helpful, and it's going to set you on the right track.
This is a
Yeah.
great segue, Ben, right?
Well, I was
Just
just gonna
about the
say,
transparency that we have.
yeah,
Yeah, take it.
100%. Like I've been with the company for 7 years, and I try to put myself in the shoes of the people that I'm working with. And I know that it's a really big, important decision for you all coming out of dental school and finding the right opportunity. And I share numbers on the front end with students out specific opportunities so that they have an idea if it's something that's worth their time and actually pursuing in the interview process. But not only from that, once you're done with your site visit, and if an offer is being extended, Dr. Zeta can attest to this. I set up a video call just like this with the two of us. I share my screen, I go over the numbers of the practice, I pull up a calculator to kind of show, the doctors like, hey, if you were the full-time associate in this office for this month, this is what your earnings would have looked like. I even pulled up a P&L with Dr. Zeta and went through it month to month to month because I knew that, to Dr. Zeta's point, numbers were really important to him, and it's a valid, important factor that I would be really asking questions about and making sure I find the right opportunity as well. So, um, long story short, I'm very transparent. I share numbers with students on the front end, and then also, really go into more detail when it's actually coming to the offer standpoint so that you have a really good idea of what the earnings potential were to look like in that office on top of just what the demand in that practice looks like.
Excellent. Nice. Thanks, Ben.
Yeah,
Ben's your matchmaker. So
I
we don't have
try.
any questions coming in. Here we go.
Hey,
Do
I
the
have a quick one.
locations you work at have appointments for new patient exams pretty readily available, or are patients having to wait months to come in? Who wants to take that one?
I mean, I feel like, we have people that will sign up, but then they take a month to come in. But we definitely are always seeing people. Like, I don't know. And the nice thing is, like Ben said, you can see every office's schedule. Like, even myself right now in Florida, I can type in an office number or a location anywhere in the country and see their schedule for the week, whatever the case may be. But, like, I at least know from my personal experience at my office, like, I mean, we see about 8 new patients a day, every day. Um, some days if we know we have big implant cases or something, we'll put them off. But we are always seeing people.
And
Yeah.
that's
So
information that I can also share too on the front end about a specific practice, what the average days are for a new patient to come in for their new patient exam. But sorry for interrupting, Dr. Zeta.
a lot of the time, how it works with Aspen is, the patient will see a commercial on TV, right? And they'll call the number, and that will lead them to a person that's going to talk to them, and basically see their location, where they're located, where they're at, and schedule the visit for them. So like really a lot of the time, it's they don't even call the office. Sometimes, I mean, sometimes they walk in and like actually schedule an appointment, but a lot of the time, like they do it on the, I don't know what that's called. It's like the call center.
Call
Yeah, call.
center. Yeah.
They call the call center, and then the call center like handles the rest. So I mean, looking at like my schedule, for instance, if there is an open spot for like where we could fit a new patient, they will fit a new patient. It's not like my schedule is booked for the next like 3 months or anything like that. It might be booked for the next like 3 days, but it's like constantly being created, right? So I personally haven't had that issue with patients telling me like, oh, like I've been waiting months to get in here. Nah, not really, actually. So that's been good.
Yeah.
And
Nice.
the great thing is, you're not calling your patients anymore. You're not begging you know, the people for chairs. You have a whole front office that handles everything for you.
Thank
The
God.
comment was, thank God. Yeah.
Yeah.
And,
And
Yeah.
and also to go off of that, something that I was like shocked by is like when I started working here, you realize like everything. I mean, like I get why they do it that way. No, but like we have to learn things the hard way. We have to learn how to do every part of the procedure. But at Aspen, like for example, for like a crown prep, I go in, I numb, I go see another patient, I come back, do the crown prep, and it's done. Like the assistant scans and then makes the provisional. So it saves a lot of time in that regard, and that's more time for you to be doing other stuff, seeing other patients. So
Nice. We have a question coming in. When you guys first started, how did you get incorporated in learning the way the office works prior to starting work at the locations? Would you guys like to go in and shadow, or is there a training program that you start before you see actual patients? It's a great question.
Yeah, I shadowed. Like, my doctor was cool enough to bring me in for, before you get licensed, you're not technically supposed to be there working. I wasn't working on patients or anything. I was basically learning the flow of, this is what my day is going to look like. And like I said, I was a shadow. And then so I shadowed him for a week. And then the next week, I shadowed the office manager. And I like learned, okay, this is how the office inner workings are ran. And so doing that extra couple weeks before I was licensed got me up to speed so that once I was able to actually put my hands on patients, I was ready to go. I had an idea of, okay, this is how we like to do things here in regards to, when we take an impression for a denture, as long as the patient makes it to their appointments, we'll have that denture ready in 2 days. And so like I learned how the workflow of how to get from A to B, and then just how to balance everything, because I think that's the big thing, and is balancing. Like, you're not just with your one patient where you're waiting around for start checks. It's you say hello, get them numb, and say, I'll be right back. Go to another office, get them numb, go back to the other one, meet a new patient. And so getting used to that flow is super important. So I'm very lucky that, I got to go in and work a little bit prior.
What was your experience like, Juan?
I didn't have that experience because Eric, I think you started super early. I remember you started early,
Yeah.
but I started later, so I just kind of got thrown into the fire. But that's what I wanted. It's not like they threw me in. I was like, all right, good luck. Like I wanted, like I felt ready. And, like day one, the lead doc, she asked me like, what do you feel comfortable doing? I told her extractions, crowns, and she was like, all right, and I started doing extractions that day. But like it was like, I will say there was like a ramp up. I wasn't seeing, like I didn't have my. I think it's for a whole month. You don't have your own column. You kind of just do a little bit here and there. And after a month, you do have your own column, and those are like the procedures that you have to worry about. And slowly you start seeing new patients because, again, you know that's hard. Like seeing new patients is hard. Like seeing X-rays and being like, this is the definitive treatment plan that I have for you. Like sometimes that is a challenge, right? So like that's the thing that takes the most time. Like crowns, like you've done a million crown preps, so you're gonna know how to do that, right? Like you're gonna know how to do fillings. You're gonna, for the most part, know how to do extractions. So everything else, it's really up to you. You can also say, hey, I don't feel this comfortable. I don't feel that comfortable doing this procedure. I'd like to take it slow, and then you can like shadow the other doctor for that. It's really like it's very very flexible. It's whatever you want, and you really at your own pace, But yeah, so I feel like it's helpful, and it depends on the person. So everybody is different in that regard.
Yeah, the next question is about specialists. So, do y'all have specialists come in, take on more of the complex cases? If so, how readily available are they, and how often do they come in? And are they open to teaching you?
Oh yeah, definitely. Like I personally don't do root canals in my office, which, coming out of Nova, everyone's like fighting for root canals, and you think they're so cool because, I mean, honestly, the endo faculty at Nova is awesome. Love every single one of our staff there. But in the real world, I think endo sucks. It takes so long to do. It's so complicated, and it's like the profit margin that you get for your time isn't necessarily worth it. So it's always nice. We have our endo come in twice a month. So we build their schedule. And same thing with our oral surgeon, comes in once a month to do primarily wisdom teeth. If you see a lesion or something on a patient and you're like, I think this should be biopsied, they come in and biopsy it. But the beautiful thing about it is it frees you up. And now when you get your endo in, they do the root canal. They It's like they tag you in. Once they walk out, you come in, you start doing the crown. And it's such an efficient method of getting things done that the patients are always super pumped about it. But it's nice too because our endo actually graduated from Nova a couple years back, and she walks me through like, hey, this is exactly how you should diagnose, a root canal, or like these are the tests you should go through before, because then you can determine whether I can save it or whether you should just pull it and do an implant. So it's really nice that you have those people to bounce the ideas off of.
Yeah, so going off of that, it's like a well-oiled machine. It's a very highly efficient system. So endo comes in, like you're not gonna have endos every day. All right. Like they're not like fillings. They're number one, can the patient afford a root canal, or do they just want to pull the tooth? So that's the first thing. So we basically build up the schedule of the endodontist, and then they'll come in 2 to 3 times a month depending on how quickly their schedule gets filled. So they have a day, let's say a week from now, and then we slowly build that schedule for them. And if for some reason the schedule doesn't get filled, then it goes on to the next week, or however that works. But yeah, I mean it's a good system because, like, for example, the other day I had a patient that had a clean in the morning, then they had a root canal, and after the root canal they were scheduled, like I was scheduled, they were scheduled with me right after for a crown, and I also did some fillings. So she spent like 4 hours there, but she got like all her treatment done. So some patients want to do that, and like she was super happy that she could get it all done quickly. But yeah, and I mean, if you have like, I feel like at least for me, one of the hardest things is like diagnosing vertical root fractures. I feel like that's like tricky, and a lot of the time, like you can basically send that patient, basically tell them like, I believe you have vertical root fracture, but we want a second opinion from a root canal specialist. So we send them with the root canal specialist for an evaluation, and that's like a way to verify, uh, what's going on, because also what can happen sometimes if you're 50-50, like if you're like, oh, does this tooth need a root canal, or should we just go ahead and pull it? You can schedule that patient for the root canal, and if the endodontist doesn't think the root canal, like if it's not going to have a good success rate, he'll just tell you like, hey, like pull the tooth. So I feel like that's pretty cool too.
Nice. Great question coming in about autonomy. Do you have autonomy in your treatment planning and patient care? Are you completely trusted? Or does your owner doc or lead doc kind of come in and tell you what to do differently?
Yeah, I mean, I don't even trust myself most of the time, so it is always nice to have somebody kind of keeping an eye on you. But yeah, my doctor and I work together very closely. So, you know, I sometimes treatment plan things for him. And when he gets the case, he'll be like, hey, I saw you planned this. He's like, I understand why you thought that. That's the dental school way of thinking. He's like, this is the real world thinking. And then he'll walk you through this is why it should be something different. It's never like, you're such an idiot. Change this. This is terrible. It's like, I get where your thought process was, but this isn't how we do it nowadays. Now you are going to do it this way, and watch how much more profitable it's going to become, but also the patient is going to have a much higher satisfaction level, which translates to now you're getting better reviews online, or they tell their family and they bring in more people. So it's like, yes, I can treatment plan anything I want, and it's your name on it. So you got to make sure that what you do, you're confident in doing. But at the end of the day, if you're questionable in something, or, you know, I want you to look at this. Do you think this is the right plan? They're like, tweak it a bit, you know? So they are confident in letting us do our own thing. And like, also, I saw the biopsies question. Like, whenever you have oral med stuff come up, like, I don't know if y'all have studied for the boards yet, but save all of the oral med stuff, the pictures, because I keep my iPad at work, and I think I look at that thing like twice a day just to be like, oh, that looks like this. And then I pull it up and I'm like, that's what it was. But your oral surgeon comes and they take care of all the biopsy. You just have to say, come back on this date for the biopsy.
Awesome. Dr. Zeta, what's your thoughts on how's your experience been in your practice when it comes to clinical autonomy?
Yeah, so I feel like that's a good question, really good question. Really, for the most part, for me at least, it hasn't really been an issue. I'm mainly more the one that is asking questions in regards to treatment planning, because a lot of the time, like, we're taught at school to save everything, right? Like save all the teeth all the time. And that's not necessarily what's best for the patient always. So, at a certain point, you got to realize like just the amount of money that the patient is spending on, um, it can be root canal and, post core buildup and a crown versus, and then you do all that. And like, how long is that going to last them? Is that going to last them their whole life? Or like, what's the prognosis of that too? Because, like at that point, you're probably just better off pulling it and doing an implant that's, definitely is going to have a better prognosis, going to last you longer. So, in that regards, like it's a lot of like learning, and for the most part, for me, I'm mainly the one that goes to the lead doctor and asks like, hey, what do you think about like what I treatment planned for this patient, right? And a lot of the time, she'll catch things that I miss too, and she'll be like, oh, like like I noticed you didn't put this here, but like Eric was saying, it's not like in a bad way. It's more like in a teaching way, and so I feel like that's really good.
Awesome. We're coming up to an hour here, everybody. We have one last question that's pretty important. It's about curious what month you guys were in your D4 year when you guys ended up signing with Aspen. When did you make that decision? You each have your own little story.
Yeah, I mean, I think Ben dug his claws in me deep, He No, I mean, I went to, I was very transparent with them the way they were with us. Since D1 year, I went to every DSO dinner, lunch, whatever, because I knew that was my route after school. And, after going to some of the Aspen ones, I was like, damn, like, you guys really have your stuff figured out. And then Ben and I coordinated, and I think I ended up signing in like November or something, right? Like,
November. Yeah,
yeah,
wasn't it
probably.
November, Ben?
Yeah, it was like in towards the end of November, maybe in the beginning of December, but kind of around
Yeah.
that time frame.
Yeah, so I was pretty early to do it. I mean, I don't know if I would even consider that early though, because, you know, offices fill up, space goes quick. You're not the only dental school out there with graduating people that want to live in Florida. So, it's smart to do your research. Don't rush into anything, obviously, but don't drag your feet because you'll be surprised how many people in your class will be at graduation with no idea what they're doing, for work. So don't be one of those people.
Juan, how about you?
I would definitely say like, well, first of all, to answer the first question, I don't exactly remember. I know it was later. It was after Eric.
Yeah.
I want to say before, maybe like a month or two before graduation.
I can tell you.
Ben's looking it up.
I'm looking it up. I'm
Yeah,
sure
I
it
thought
is
it was right
now.
around March, April,
Yeah, I
It
feel like
was in
around there.
February,
Oh,
February.
okay.
Wow.
There we
I
go.
think.
So
Yeah.
yeah, um,
Wait.
so I saw there was a question here about traveling to other offices. I wanted to answer that real quick.
Sure.
So yes, but like not frequently. So let's say a doctor is going on vacation. Okay, like we go on vacations too, like and things happen and emergencies happen, and sometimes the doctor can't go to work that day, and last minute they might call you and ask you, hey, can you cover mainly for the I mean pretty much always for the associates, right? Like they ask you if you want to do it. It's not like you have to do it, but at least for me, I like doing it. I like to I've covered in Miami a couple times, different offices in Miami, and like they pay for the hotel, and that's cool. They pay for mileage, so it's just kind of like a little like mini holiday. So and then you get to also the cool part about it is you get to see how a different office works and how they function, and you get to try different things. They might have different materials, and working with a different staff for a day or two. That's pretty cool, but I feel like in total, since I started working, it was 3 days at one office because this doctor was on vacation, and then 2 other days at the Miami office.
Yeah, and it was a positive experience. Yeah,
Yeah,
that's cool. Yeah, so I want to thank you, doctors, very much for joining us tonight. It was
Yes,
actually
thank
amazing
you.
to see you both. I think for Ben, he's talked to a lot of you that are here tonight. And Ben, you have some words of wisdom and maybe hoping to connect with some more people.
Yeah, so I appreciate to kind of echo Maggie's, words. I appreciate both Dr. Zeta and Dr. Klein, especially after a long day, jumping on this call. I put in the chat my cell phone number, so for anybody who I haven't spoken with, by all means, feel free to send me a text message. We can set up a time to talk whenever you're free, after hours, when you get out of clinic. But my word of wisdom would be, don't just speak to Aspen Dental. I mean, and that might be something bad to say, but it is an important decision for you all. It's important that you talk with other employers to see what they can offer you in relation to Aspen Dental. I would be lying to you if I said that Aspen Dental is the right fit for every single doctor that's out there. It just that just isn't true, right? But um, I pride myself on being very thorough with information to provide to you all on the front end so that you can make the right decision. Um, and for all the students who I've spoken with so far, I definitely plan to keep in touch with you on at least a month-to-month basis. And as soon as opportunities start to become available, you'll be hearing directly from me. We can set up a follow-up call where I can go into more details with you about that specific opportunity, so that you can make the determination if it's an opportunity that would be worth your time in setting up an interview for. And then we set that up and kind of go from there.
Yeah, and then we'll be doing events in Fort Lauderdale. Hopefully, Dr. Klein and Dr. Zadia can join us in Fort Lauderdale for some D4 dinners.
Definitely.
Everybody that registered and attended this call tonight is going to be receiving a $25 gift card. You'll hear from me. I'll be texting you in the morning. So I'll connect with you and get that $25 gift card to you. And we really appreciate y'all coming on tonight. Thank you, doctors. Thank you, Ben.
Maggie, before we go, can I just add one
Sure.
thing?
Oh, closing remarks.
Yeah. For everybody out there that's still kind of curious about Aspen and like what it's like to be one of the doctors here, I just posted in the chat. Go on Instagram. Like if you have your phones now, pull them out. It's called Life at Aspen Dental. And I mean, the social media team for our place does an amazing job putting out videos of the different courses we take and just showing you what it's like to go on those trips to Chicago, be one of the doctors in an office. So I highly recommend following them because I don't know. I mean, I was one of the people that started following them. Maggie was nice enough to put one of my interviews out there. So it's just a great resource to have.
It is. Follow Life at Aspen Dental. Great plug. Great plug. Bravo. Thanks, everybody.
Yeah. Take care, guys.
Juan? Thanks, guys.
Thanks, y'all. Have a good night.
Good night.